Hello, good evening. I'm your host, Dr. Festus Osai. You're welcome to your doctor and you. Yes, some will say it's just a common headache. No, just a common chest pain that's been worrying me. Don't worry, there's no problem. The child is just vomiting, just an ordinary vomiting. Oh, it has just passed. We've been having diarrhea for like 5 times. No problem now. That can be taken care of. Just go to the chemist and buy drugs. The pain. It normally has this pain, but don't worry. Let's just leave it. It will be fine. Oh, don't worry. I'm not a hospital person. No matter how sick I am, let me be at home. And the next thing, when the situation is so bad, they rush them to the hospital. And when they come, they want we doctors to perform magic. We are not magicians. We work based on principles. I'm your host once again, Dr. Festus Osai. Now, I'm talking about late presentation of patients to the hospital. Why is it that you commonize the headache, you commonize the vomiting, you commonize the diarrhea you're having, or even that of a child as well, or you commonize the abdominal pain you're having because you believe it's just a minor thing until it gets too late? Don't be surprised. That headache is maybe a warning sign of a grave danger that's coming up in your life, in your health. Or that chest pain may be a warning sign of it may be a heart attack that's coming in the next couple of minutes or even hours or even minutes if nothing is done. Don't be surprised. That abdominal pain may be pointed towards something. Or that fainting spell, feeling as if you want to faint, maybe something that will lead you to your early grave if nothing is done on time. So what I want to say is this. Do not commonize your ailments. No matter how simple your sickness may seem to be, try and visit your doctor. Try and go to the hospital and see him. Don't just go to some of you just walk down to anywhere and say, I want to run tests. You don't even know the test you want to run. I want to run ear test, leg test, and nose test. First, you run a number of tests and it doesn't mean sense to you. But your doctor will direct you, will see you, ask you questions, examine you, and tell you all the manner of tests you need to do that will tailor down what will likely be your problem. And of course, the treatment will be tailored down to the cause of what is giving, what you're going through at that point in time. So I will advise you, whether you are the one, your wife, your children, anybody you say, please go to the hospital on time. What are the advantages of going to the hospital on time? Number one advantage, it gives you an opportunity for your life to be saved. Some people died because they presented to the hospital very late. There was the time they rushed a woman, she was bleeding. Before they got to the gate, the woman was already dead. I don't resurrect the dead. If she was alive, would have done something to save her, but nothing could do. The woman was dead before they got to the gate. So if you present early, of course, you will save your life. And you give your doctors an easy chance to do a better job for you at that point in time. What are the other advantages? If you present early, you spend less money in the hospital. And of course, the possibility of being admitted is less when you present quite early. And of course, your recovery will be faster. And of course, you go back to your workplace on time. The opposite or the reverse is the case. If you decide to present late to the hospital, anything can happen. You've heard about people slumping down. After so many meetings, they just slump and die. Some, if they are lucky, they may come down with stroke, maybe with paralysis on one part of the body or not. While some, when they vomit, there was one I was in school, a young man kept vomiting and he died, collapsed and died in the hostel. But if that boy had gone to the hospital on time, he would have saved. That means saved. What of some women? Pregnant women will be bleeding, they'll keep them at home or go to a maternity home. They bleed and they first go, either they die or the child dies. And let me tell you, presenting early will save a lot of lives and save a lot of money, save a lot of things that will help us in this country, in our own system. And mind you, if the total workforce, majority of workforce are ill because of late presentation to the hospital, what happens to the country? Of course, the economy will go down. We want you to be healthy. Come to the hospital. Whenever you're in this country, go to your hospital, see your doctor. When you have any, no matter how simple that symptom seems to be, see your doctor and talk to him. Of course, he will render a service for you as early as possible. Stop going to buy drugs you do not know in chemists. Buy drugs. You see some people that have chemists in their houses. So many drugs they're taking that they don't even need to take. But when they come to the hospital, in fact, you don't even know what to start with from them. Plus, if you want to live long, if you want to live well, present early to the hospital and your life will be saved. Well, I'm your host, Dr. Festus Osai. Thank you. Present early. Thank you very much.